Good afternoon. This is Dr. Reese, and I'm coming to speak to you today about the topic of tooth extraction. While tooth extraction is something that virtually none of us looks forward to, in many cases it is actually the best thing to do and may in fact save you much pain, suffering, and infection. The most common cause for needing to have an extraction is excessive tooth decay. If a tooth gets a cavity in it and it grows large enough, it can get to the point to where it is non-restorable. I've also seen teeth need to be extracted because of splitting. It's real common for teeth with large fillings to break, and if those breaks break into the nerve, well then those teeth as well need to be extracted. And thirdly, the most common cause that most people think of is wisdom teeth. Now, if your wisdom teeth erupt and you have room for them, they're just as good as any of the other teeth. The problem is most people's jaws just are not large enough to accommodate all their natural teeth plus their wisdom teeth. And also many times wisdom teeth cause infection and pain as they erupt. Many dentists believe that the wisdom teeth can also crowd the permanent teeth and cause them to be crooked, especially after braces. And then after the tooth is extracted and any infection gotten rid of, well then you're going to need to take care of that area that has been extracted. The things that need to be done are, number one, it needs to be kept clean. Number two, we need to get the bleeding to stop. That's why we use the gauze to bite on. And cold things like ice and soft drinks that are cold tend to help stop the bleeding, whereas hot things and too much activity tend to increase the amount of bleeding. And then finally, after you take that tooth out, you need to consider whether or not that tooth needs to be replaced. With wisdom teeth, many times the wisdom tooth doesn't need to be replaced, but with most other teeth, replacement of the tooth so that you have full functioning and full chewing is very important. Implants are now considered the standard of care, and most teeth that are extracted would best be replaced by placing an implant and a crown. Now, you can also replace a missing tooth with a bridge, which is either fixed or removable. You can have a bridge that stays in all the time and is attached to the tooth in front and the tooth behind, or you can have a removable bridge, which usually use wire clasps that wrap around the tooth, and this is taken in and out. Generally isn't as comfortable, but it's an acceptable way to replace teeth in most people. I hope that you had a good time today. I certainly did. Thank you very much.